Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith-Rogers. Today, the Building H Index, a rating of consumer products and services for how they influence the health of their users. Steve Downs, a co-founder of the Building H Index, talks with Dr. Josh Sharfstein about the origins of the ratings, how it works, and what companies rate the highest and lowest for health. The Building H Index, by the way, does not receive any funds from the companies that are rated. It is a program of the nonprofit Public Health Institute. Let's listen.
Steve Downs, thanks so much for joining me today on Public Health on Call to talk about the Building H Index. And am I correct that the H in the Building H Index stands for health?
You are absolutely correct. It does.
And the index in the Building H Index is like a ranking of companies for how they relate to health.
Exactly right. Yeah, the Building H Index rates and ranks everyday products and services on how they impact the health behaviors of their users. So we look at products and services across 4 industries: entertainment, food, housing, and transportation. And these are products like Netflix, Uber, DoorDash, also restaurants like Chick-fil-A and Taco Bell, automobile manufacturers like Ford and Toyota, and even the nation's largest home builders and apartment managers. And we ask, how do they affect the way we eat, how much physical activity we have, how we sleep, how we socialize, and how much time we spend outdoors? And last fall, we released a report rating more than 75 popular products and services. I think what's interesting is that the companies behind these products are not in the health business. But what we're showing is that they have very real impacts on health and impacts that we believe factor into the rise of preventable chronic illness in the U.S.
Now, where did this idea come from?
So Thomas and I Thomas Getz, my co-founder, and I started Building H several years ago because we believe that it's actually become pretty hard to be healthy in the U.S. It's hard to eat right, hard to get enough physical activity, hard to get consistent, sufficient sleep, and even hard to spend enough quality time with friends and family. I think we all struggle with this to varying degrees. Part of the reason is that we have so many products and services, products that are really kind of woven into the fabric of our everyday lives that too often push against these healthy behaviors. In effect, they're creating conditions that need to be overcome in order to be healthy. And I've often said that in order to be healthy in the U.S., you have to swim upstream every day. And that I think our societal response to that, in a lot of ways, is to try to help people become better swimmers. And that's good, and it's actually quite necessary and important. But we also need to focus on how we might be able to reverse the river, to really change the landscape of products and services that shape our health behaviors so that they become much more supportive of our health.
Such an interesting idea. Can you take me a little deeper into the ranking for one of your products or your analysis of one of these products?
Sure. Why don't I actually start with the top-rated product? I can also do the bottom-rated, but the top-rated is actually a small company called Cul-de-sac, which is a real estate developer who built a car-free apartment community outside of Phoenix, Arizona. And so if you just start with that implication, right? You can't own and store a car on premises, but it has access to public transportation. They have lots of rentable bikes and scooters. And they provide discounts, I think, for ride hailing as well. So that really gets you into active transportation, so you're going to be much more physical on the transportation side. But they've also gone further. They provide access to fresh foods in the kind of community there. And they design the community to create a lot of outdoor social spaces. So people are able to spend time outdoors. They're able to be very social. And they even, for good measure, designed the apartments architecturally to have as much natural light in the units as possible, and that can help with syncing up your circadian rhythms, which can be beneficial to sleep. So they really kind of hit on all 5 of the behaviors that we actually look at in terms of the index.
And is that community for a particular population or is it for anyone?
It's for anyone. I think it's around market rate or maybe slightly higher than market rate for the community. That's an example of a really positive one. At the bottom end of the scale was actually Netflix. And I always sort of feel funny about talking about Netflix because as a consumer, I think there's probably much to like about Netflix. But if you think about it, TV watching, actually, there's a lot of studies that show a negative impact on diet. It's obviously, in most instances, a very sedentary activity, so not a lot of physical activity. It's definitely, or almost definitely, indoors most of the time. And it's sort of a plus or minus on social connection. It depends how it's used.
I look at your index and I think the kinds of services that are at the top are things that could really get me out and about, moving, maybe more social. And the ones at the bottom are the ones that maybe I'm sitting on my couch and kind of doing by myself for hours at a time.
Yeah, I think that's a pretty fair way to parse it. I think one of the trends that's sort of long term here is this sort of idea that you can do pretty much everything now from the comfort of your own home. I mean, it used to be that if you thought about entertainment, that was something that was often very public and shared. Think about going to the movie theater or something like that. But now we have bigger and bigger screens and 24/7 content. And so you do it at home. Same with food. The restaurants did come back after the pandemic, but they're making their money off delivery and takeout, not on going out and being social.
Anything surprising in this ranking? Like if I were to spend a lot of time looking at these different companies, I have to tell you I'm not shocked that Netflix is kind of towards the bottom here. Anything surprising in terms of, companies that you might not think are designing their products in a way that is conducive to health, but actually they are doing some things that might be helpful?
Yeah, I would say there are actually two categories of products that were a bit of a surprise. And one is automobiles. So we looked at automobile manufacturers. And if you think about automobiles in general and sort of their historical impact, it's been quite negative. It's a less active form of transportation. They allowed us to sort of move further apart from each other. But I think as a consequence of all that, they've actually become then very, very necessary for people in today's world, particularly in communities that are quote unquote car dependent. And so, in order to get groceries to cook healthy dinners, you need a car.
But for all of us who are not living in that apartment complex
For
in
all of us who
Phoenix.
are not in the little, in the cul-de-sac outside of Phoenix. Exactly. And I think so even seeing your friends often requires a car. If you want to do outdoor recreation, you often need to drive there. And so what you could say it's an artifact of our index is that we look at how does the product affect health in the world today that exists, not necessarily how it happened over time. I think a similar thing happened a little bit with social media, and the companies didn't score great. Social media. Our scale is 0 to 100, with 0 being negative, strong negative on all 5 behaviors, 100 strong positive, and then 50 is kind of neutral. The social media companies were sort of in the high 30s, low 40s, and I think they did better for a couple of reasons. Because I think they're often singled out for a lot of health harms. But there are a couple of things that happen. One is that a lot of the research is pretty mixed and inconclusive on social media. And so you see that often the effects are not quite uniform across people. And there are people that have very positive experiences as well as negative experiences. We actually did our own consumer research for this work where we asked a lot of questions about social media use and the different health behaviors and actually found some sort of interesting paradoxes. People that used social media more often were also more likely to report being lonely, but they also reported that it had a more positive impact on their social connection than people who used it less. And similarly, people who use social media, there were a lot reporting that they were using it a lot before they go to bed, just before they go to bed, and even waking up during the middle of the night to use it. And yet they actually reported some of the same numbers around overall sleep duration that people who are using it less. So I think what happened is that on the one hand, we sort of had to report all these mixed research conclusions. And I think our reviewers who scored all of the products their scores reflected that. The other thing is I think not unlike automobiles, social media is a little bit like it's there. It is actually where you find people. And so if you want to connect to people, it's sort of hard to avoid it in a lot of ways.
Talk to me more about your methodology, because my initial picture was you and your co-founder watching a lot of Netflix and writing down your scores,
No,
but it sounds like it's a little bit more elaborate than that.
it is pretty rigorous. So first we research all the products. We look at how they're designed, how people use them, and what's known about how they influence each of the 5 behaviors that we focus on. So we use information from the company. We go through news stories, market research reports, products reviews. We do some testing ourselves, just mainly to understand the functions. We rely heavily on the scientific literature for studies that link the different types of products with the different health behaviors. So, for example, I mentioned there's a robust literature on TV viewing and diet. And then we actually conducted I mentioned a lot of original consumer survey research that looked at how people use the products, their overall health behaviors, and how the products are connected to those health behaviors. And then what we do is we actually take all that information, we synthesize it, and develop profiles of each product where we go in and say, is our analysis of how each product affects each behavior, along with any evidence we have to support that. And then we go to the companies and say, hey, did we get anything factually wrong? Did we miss anything? Is there anything you feel like we are just flat out wrong about? But then when we finalize the profiles, we actually send them to volunteer reviewers. And we were so lucky, we managed to recruit nearly 200 people with backgrounds in public health and healthcare and health policy. And then they would take our analyses and convert it to numerical scores. So they would say, well, based on what you've said about Netflix and sleep, we think it's a moderately negative influence. And then we take all the numbers and aggregate them, and everybody gets a score from 0 to 100. So yeah, it's a lot.
How would you like people to use this index?
Well, I think there are 2 levels to this. And I think one of it is to think about consumers, and I have some thoughts for them, although it is primarily not aimed at consumers. But let me go through the consumers first. And I think that the issue there is that I think it's helpful for consumers to be aware of how these products work, and particularly if when they're being manipulated by the products. So we're certainly not suggesting that people go out and start boycotting the companies that scored low, but I think pushing back against some of those manipulations. So for example, when fast food companies are upselling you at the checkout process, resist. Turn off the notifications designed to pull you back into your social media platform when you're getting ready to go to bed. Disable autoplay on your streaming service. And so the next episode doesn't begin before you've had a chance to think about whether you want to watch it. Actually, smartphones have bedtime settings. So if you haven't set that on your phone, go do that. But I think these are sort of small tweaks that users can control. But I think it's really important that the challenge not be laid at the feet of consumers. I think we really have to change this environment, not simply encourage people to try to overcome it. And so when I think about what we want people to do about this is I think this is about an idea, and really getting an idea into the mainstream discussion. And that idea is that the products and services of everyday life are creating an environment that you have to overcome in order to be healthy. And that instead of just saying, well, we've got plenty of healthcare and we can treat that all with healthcare, or instead of saying, well, we have to figure out how to help people overcome the environment, let's actually change it so that it doesn't become so much more unhealthy. And I think this is especially urgent because we have a history of applying technology to making environments unhealthy, and we are on the cusp of a revolution in technology that is probably going to shape our behaviors even further. And so we have to do something about that.
Is there any indication that companies are paying attention?
There is. Certainly we've engaged them in the process, and a lot of them have been very responsive to that. I think they've been providing helpful information. I think, we've gotten some pushback at times, which is good, but it's always been respectful. I think actually one of the most exciting things that we saw was that we had done this report a smaller version of this report in 2022. And when we look back at some of the companies that we had made recommendations to, which is another part of our process, we actually don't just critique, or rate. We actually say, here are some suggestions for ways you could adapt your products. We actually found that a number of the suggestions that we'd made in 2022 were actually now happening in some of the companies in 2024. So that was really exciting to see some of that.
Well, Steve Downs, this is the Building H Index we're talking about. Good luck with this process, and I hope that in the course of evaluating all these products, you're able to keep your own sanity first and continue to help the rest of us figure out how best to use them.
Thank you very much. It's been a pleasure talking about it. I really appreciate the opportunity.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.